Hello again, my name is Dr. Ahmed Kamara, clinical lead at Dr2U and a practicing NHS GP. After graduating from Cambridge University over 15 years ago, I've amassed a wealth of academic and clinical medicine experience. At Dr2U, we like to inform, educate you, and help you along that journey towards becoming master of your health. One of the ways we like to do that is by providing you with good quality, trusted information by way of these videos that we record to help you along that journey. So it would be really good to hear from you about future topics you'd like us to discuss on one of our videos. Now, I want you to remember that what we're going through here today is general advice. It's not about your specific situation. Whilst there's a lot of useful self-help information that you can use, if you've got any symptoms, it's important that you speak to your doctor so you can be given the best management advice for your particular circumstance. Now, what I want to talk to you about today is an extremely common finding amongst the population, and that is headaches. Headaches are extremely common. Now, if you're listening to this, you've, I'm sure, at some point developed a headache. But as you'll know, most headaches are not severe. Most headaches are managed by the patient without needing to see a doctor. Sometimes, you manage it by having a rest if you've had a stressful day, or taking some, over-the-counter painkiller like paracetamol, or just making sure you're well hydrated. We'll talk about the relevance of some of these later on. But a very useful way of categorizing headache or defining headaches from a medical point of view, and it's useful for you to have some insight, is whether a headache is primary or secondary. Now, by primary, what I mean is the headache has developed without any underlying cause that can be found from doing blood test or doing a brain scan, a CT or an MRI brain scan. Now, a secondary headache is caused by an underlying condition, and that can be, for example, trauma. So you bang your head and you develop a headache as a result, or you have brain infection, so meningitis or an encephalitis, or you develop a tumor or growth or cancer in the brain that will also cause a headache. For some people, it may be developing what we call inflammation of blood vessels, with medical terms, a vasculitis. This can cause headache. There are lots of secondary causes, but a distinction is very important. And when a doctor goes through questioning you, this is what they're trying to distinguish. This is what they're trying to determine whether your headache is primary or secondary. Primary headaches are very annoying. They can be very debilitating, but they usually are not life-threatening. Okay. Now, secondary headaches. So if it's a headache caused by a tumor or bleed in the brain because you've had a trauma to your head, or an inflammation of your blood vessels, or a brain infection like meningitis or encephalitis. Now, these headaches can be very life-threatening, potentially life-threatening, and if untreated, are usually fatal. So it's important for us to make those distinctions. Now, what are the signs and symptoms of headache? Well, I mean, this is a very obvious one, isn't it? It's pain in your head, okay? But there are some very subtle, some very important associating features of the headache that a doctor needs to elicit in order to determine the cause of your headache. Now, I'm not going to talk too much about the secondary headaches, but we'll spend more time talking about the primary headaches. Okay, so the primary headaches tend to make up about 90% of the causes of headaches that patients experience, with the secondary headaches making up 10%. Now, when I say primary headaches, what are they? So these are things like tension type headache, okay, which in fact is one of the most common primary headaches. And then the next common is migraines. Most of you have a lot of migraines. And then you also have other headaches like cluster headache. And there's several others that are not as common, but these are I would say the big three primary headaches. So tension headache, so you get a lot of pressure, usually in the bitemporal region, so both temples, can be associated with a high degree of stress. And then you also have migraine. Now we sometimes ask patients lots of questions. Do you notice any change in your sensation, in your smell, in your taste? Do you get any flashing lights beforehand? And that is because some migraines are associated with what we call an aura. Okay, this is something that can develop usually about an hour before a migraine kicks in, or within an hour of a migraine kicking in. So it's usually quite closely associated with the headache you get in migraine, which is often one-sided, around the temporal region, but can often spread as well. The aura usually resolves as the headache improves. Okay, and then I mentioned you have these cluster headaches as well, which some people can have at particular times of the year. Some people, it can be associated with the actual weather, or which causes a change in their physiology. Now, whilst I'm not going to go very deeply into the management of the secondary causes of headache, but it's important to just be aware of some of the worrying features. Okay, so for example, if you have quite an atypical, so a very different headache from what you normally get, that's associated with vomiting, especially if that vomiting is happening in the morning, or it's associated with a high fever, so temperature that's not going away, or it's associated with neck stiffness or rash. Now, the fever, neck stiffness, and rash are features that can sometimes be found with meningitis. So if you have any of these features, it is really, really important that you seek medical advice, very, very early, so that an important secondary cause can be diagnosed early and you can be given the appropriate management. Now, what test will your doctor do when you present with a headache? Well, focusing on the primary headaches, so the migraines, cluster headaches, and tension type headaches, a lot of the time the diagnosis is actually made from talking to you and asking very relevant questions that gives us a clue. Some observations or tests can be done whilst you're with the doctors, what we call them bedside tests. So for example, your blood pressure, because if your blood pressure is extremely high and not well controlled, that can cause a headache. Now sometimes we may also look at the back of your eyes by a process called a fundoscopy. Now this is a way of looking at the blood vessels at the back of the eyes, and if there's a rise in the pressure within your brain, it can sometimes be detected using this test, and that can give us a clue as to the cause of your headache also. Now, we would often do a neurological examination, so examination of the neurological system, and this is when we ask you to do funny things like follow my finger, touch my finger, touch your nose, and show me how strong you are. Can you feel me touch you, etc. And we normally split this into what we call a cranial nerve examination or peripheral neurological examination. But what your GP will go through with you and just cooperate and follow, and it would help your doctor to also work out what's causing your headache. Now, do you always need to have a blood test, a CT scan, MRI scan? No, absolutely not. As I mentioned earlier, most of the time the diagnosis is made from actually talking to you. But there are times when those tests may be required, and that is, often to rule out one of the secondary causes rather than ruling in the primary cause. Because often, if it's a primary headache, your doctor will have a fairly good idea once they've taken a very comprehensive story about what's been happening to you. So how can headache be treated? Well, for videos such as this, I'm not going to go into the specific tablets or medications. But what's important is what you can do for yourself. So, key to managing, any headache is stress management. So you got to ask yourself, you know, have I got high levels of stress, and what can I do to manage it? So there are things like mindfulness, things like meditation. Sometimes just recognizing it can allow you to manage your timetable better, so it's not as stressful. Are you getting good enough hydration? So it's important you get, you drink a lot of water during the day. The average adult should be drinking about 10 to 12 cups of water per day. Now, cup sizes vary, but approximately, you should be aiming to drink 2 to 2.5 liters of water a day at least. The rest of the fluid you need during the day will come, as fluid that's part of the food that you eat also. Um, Now, the other thing is caffeine. Excessive consumption of caffeine, so coffee mainly, or sometimes drinks like Red Bull or even Coke, they has a lot of caffeine in it, can cause headache. So it's important to recognize this. For some people, it may be that particular types of food. So for some people, chocolate can cause a headache. For some people, it's red wine that can cause headache. So recognizing the pattern of your headaches around the consumption of certain types of food can also help you manage it well. Now, if you're doing all of those things, and not to forget, actually, sleep management is very, very important. So sleep deprivation can cause a lot of headaches. Try to sleep on, maybe 2 or 3 hours less than what you usually get, and you're probably going to get a headache. So managing your sleep well, making sure the lights are off, not having any screen time at least 1 to 2 hours before bed, not taking screens into your bedroom, having blackout curtains, for example, can help. Not looking at your phone, because you can't sleep. Resist that temptation. You know, all of these things can help you get a better sleep. And sleep management is extremely, extremely important in terms of managing headache. But of course, if all of those are not working, you can try a simple analgesia, so over-the-counter medication like paracetamol. I usually don't say ibuprofen because I don't want you to take excessive doses of ibuprofen, which can long-term can actually affect your kidneys, can increase your blood pressure. If you're going to take ibuprofen for a few days only, and if it's not improving your headache, consult your doctor is always the advice with any self-management. Well, if you have a headache, well, what are the long-term prognosis? What does the future hold for you? Well, look, it is first of all, important to say and remind you that a lot of people have headaches, and for a lot of people, it's very mild, or they manage it themselves and don't need to see a doctor. But if your headache is persisting, not getting better, it's important to go and see your doctor. In the UK, about 6% of people consult their GP. 6% of people with headache consult their GP as a result of it, and a further 2% approximately of those people go on to have investigation. So for a lot of people, a test and investigation is not required, and you can be reassured and given guidance and management advice by your GP. Now, what's really important to say is, don't just say it's a headache. Why should I go and see my doctor? Okay. Headaches have been shown by something called the global burden of disease, both in 2010 and 2015, have been shown to be the third highest prevalent disease in the world, and the third highest cause of chronic, disability. Not physical disability, but sort of disabling you to get on with your, your normal function throughout the day. So, if it's bothering you, go and speak to a doctor. Thank you, my friends. Well done for taking action today and looking at this video. I hope you've gained some useful insight into headaches, and hopefully you've learnt a lot. The important thing to say is, if you've got a headache that's not going away, you've tried all the self-help measures, you've taken some over-the-counter medication, it's not going away, go and see your doctor. Now, I mentioned some worrying features earlier, and I'll just go over those again because those are really important. If you've got a new type of headache that's getting progressively worse, or you're getting any fever with it, or you're noticing a rash developing or neck stiffness, go and see a doctor. That may be because of a meningitis or an encephalitis. If you've got a headache associated with vomiting, especially vomiting in the morning, or you had trauma, it could be several hours previously or a day even previously, and you're now getting headache, go and see a doctor, because it may be that you're having some underlying bleeding. If you've got a history of a cancer diagnosis before, even if you've been cured of the cancer, and you're now developing a severe persisting headache, whilst it may not be related to your cancer, it's important that you seek medical advice so you can have the relevant sort of examination and, if necessary, test to determine whether or not this might be a cancer growing in the brain, either as a primary cancer or as a secondary metastatic cancer, so one that's spread from its original site to the brain. I just really want to thank you so much for watching this video today, and thank you for tuning in to Doctor to You. Please share this information with your friends, your loved ones, your family. We're putting up other videos all the time, so you may find another topic that's of interest to you. Subscribe to the channel. If you have any medical concerns, feel free to contact us at any time at drtoyou.co.uk, so drtoyou.co.uk, or using any of the other contact details that you can see on the screen. Thank you so much. I wish you good health, longevity, and success in your journey to becoming a master of your health.